Hi, this is Nora, and this is Mama Denise, and this is Nora's InfantSee exam. She's 9.5 months, and so far everything is looking good. There's no problems that Mama's noted. We're just checking her out to see how she's doing.
Hi, I'm Dr. Zamberlan. First, we'll check to make sure Nora's eye muscles are moving equally and evenly. And yes, they are great. Now we make sure that as we bring a target toward her nose, each eye focuses on that target. When we get close enough, both eyes will break away. We want to make sure that each eye is moving in toward her nose at the same speed and that neither eye is turning too quickly. From this exam, we can tell she is doing super. This is a depth perception test. Although Nora cannot tell us what picture she sees, we are making sure that her eyes are looking at each of the 4 pictures. This lets us know that she is focusing using both eyes equally. Her depth perception is just perfect for her age. Now we uncover and cover each eye, which looks like we're playing peekaboo, but we are actually checking to see if Nora has a lazy eye. A lazy eye, also called strabismus, happens when some of the eye muscles are not as strong as they should be. This can cause one or both eyes to turn inward, outward, up, or down. We also check to make sure her pupils are reacting to light properly. This test lets us know if there are any problems between the front of the eye and the part of the brain that processes information. This special lens, known as a prism, alters the way that light enters the eye. It makes whatever you are looking at move either up or down. We want each of Nora's eyes to move in reaction to this test. If either of her eyes does not move, that means that she could be suppressing or not using that eye. Nora's eyes are moving just great. Now we are using a special scope to check 2 things. The first is to look at the reflection of the light off the surface of Nora's eyes. We want the light to be in the same place on each eye. These reflections are the same ones you would see when taking a close picture of someone. The other thing we are looking at is the alignment of her eyes, making sure they are straight and even. With these glasses and this scope, we are estimating what Nora's prescription is. We can tell in general if her eyes are far-sighted, nearsighted, or if she has astigmatism. We will check more on this later after she is dilated. But first, we will put in some dilating drops. We can sometimes skip this step, but Nora has smaller pupils, and we really want to make sure we get a complete and thorough look at both her prescription and eye health. Babies are actually the easiest patients to give drops to. They don't mind them at all, and they recover more quickly than adults. Nora was a champ. Now that Nora's eyes are fully dilated, we can really check to see if she has any prescription. It is important that each eye has the same prescription. If one eye has a larger prescription, it seriously affects the baby's vision and can cause all kinds of issues, from difficulty walking, trouble learning things, and if left untreated, that eye may never develop normal vision. Most babies are farsighted, which means that their eyes are shorter from front to back. As they grow taller, the eyes also grow longer and begin to develop normal vision. When babies need glasses, the sooner they get them, the better chance the baby has of developing normal vision. This special microscope that fits on my head and the lens I am holding let me examine the back of Nora's eyes. The flashing light is just there to keep Nora busy. You can see though, even with that, she keeps trying to grab my lens. The back of the eyes is called the retina, and it is where all of the light that comes into the eyes is processed and sent to the brain. Here we are looking with one more light to make sure the front, middle, and center of her eyes are healthy. Sometimes babies are born with congenital cataracts or glaucoma, and it is important that we diagnose and treat those conditions as soon as possible. Nora's eyes are completely healthy. Nora did just great. She has some farsightedness, but not too much, so she does not need glasses at all. Also, her eyes are completely healthy. She is perfect, and we'll just see her back for her yearly eye checkups.